Hey guys, I'm back. So now comes the treatment of diabetic ketoacidosis. The first treatment that you would initiate would be aggressive fluid resuscitation. They will be bolusing the patient, say for example, with 1 liters of LR. So aggressive rehydration is very important because that would help flush out the ketones from the body. So the PAs or the doctors would be ordering the IV fluids. And then the second and the most important treatment of diabetic ketoacidosis is insulin drip. Insulin drip would be starting on a patient. It's very, very important for the nurse to monitor the blood sugars level every hour. The insulin drip is high alert medication. It is verified by 2 RNs when they would be signing and co-signing in the EMR. It's very, very important to notify the provider every hour about the blood sugar levels, because based upon that, we would be rectifying the anion gap with the insulin drip. We will be rectifying their blood glucose levels, but at the same time, so we don't want their blood sugar level to drop too critically because of the insulin drip. So if that is too low, the patient would be started on D5 normal saline or D5 half normal saline, because we can't aggressively stop the insulin drip as the anion gap would still be open, but we also don't want their blood sugars to drop. So we will be starting them on D5 normal saline or D5 half normal saline based upon the provider to maintain their blood glucose levels. But however, if it is critically low, then it's very important to advocate for the patient, and the provider would be stopping the insulin drip if it is needed, if the anion gap is close to being closed, or whatever the provider feels like. But again, we would keep the patient on the insulin drip until the anion gap closes. Say for example, the blood sugar is 125. It is low, but at the same time, we have them on D5 normal saline and then hourly blood sugar monitoring to make sure that their glucose, their sugar is okay, but closing the gap is very important. So the third would be the potassium replacement. Insulin drip can cause hypokalemia. So it's very important to check the BMP and the serum bicarb, serum potassium on the Q4 or Q3, whatever the provider wants, the electrolytes per protocol or per the doctor's order, to make sure that the potassium is not critically low, and then to also monitor for the serum bicarb and for the anion gap on the BMP. So fluids, aggressive fluids, insulin drip, potassium replacement, and supportive treatment for the patient. These are the major 4 interventions that you would be taking as a registered nurse to make sure that the DKA is being resolved. Thank you guys.